So hello everybody. In this video we'll be talking about the lungs, also known as the pulmons. Lungs are basically the principal organs of respiration. So there are two lungs situated in the thoracic cavity, one on either side of the mediastinum and closed in a pleural sac. Now if we talk about the right and the left lung, in the right lung you have got two fissures, okay, horizontal fissure hota hai and you have an oblique fissure, because of which the right lung has been divided into three lobes: superior, middle and the inferior lobe. Whereas if we talk about the left lung में आपका सिर्फ एक ही fissure होता है, which is known as the oblique fissure, and therefore you have got only two lobes in the left lung, that is the upper and the lower lobes. Now if we see the lateral view of the right lung, we can see the oblique fissure runs obliquely and the horizontal fissure runs transversely. Now these are some extra details which are not required. That is the right lung weighs around 700 grams, whereas the left lung weighs about 650 grams. The right lung is larger, shorter and broader, whereas the left lung is smaller, longer and narrower. Now if we talk about the external features of the lung. So the lung has got the following parts. One being the apex, the other is the base. There are three borders, okay. One anterior, one posterior and one inferior, and there are two surfaces. One is the costal surface and the other is the medial surface, which faces towards the mediastinum. Now if you are given a specimen of the lung and you are asked to hold it in an anatomical position, तो आप उसको कैसे hold करोगे? For that you need to put the apex in such a way that it faces upwards. So the apex is conical, so it should be facing upwards. The base should be facing downwards. The costal surface, which has got impressions for the ribs, should be facing laterally or outwards, and the medial surface should be facing medially, that is towards the mediastinum. Now, how will you understand which is the anterior border and which is the posterior border? Always remember, the anterior border is thin and sharp, like it is well defined. Whereas if we talk about the posterior border, it is ill defined and rounded. This is a very important point which will help you differentiate between the anterior and the posterior borders of the lung. Now if we talk about the individual parts, we have the apex. Apex is basically the rounded, blunt, superior end of the lung. It extends up to the root of the lung. So you can remember a few measurements if you want, such as it lies 3 cm superior to the anterior end of the first rib, and it lies 2.5 cm above the medial 1/3 of the clavicle. Okay, now it is covered by cervical pleura and suprapleural membrane. Now if we talk about the relations of the anterior part of the apex of the lung, we have the subclavian artery, we have the internal thoracic artery, and we have the scalenus anterior. Now if we talk about the posterior relations, we have the neck of the first rib, ventral ramus of the first thoracic nerve, first posterior intercostal nerve, intercostal artery, first posterior intercostal vein, and the sympathetic chain. Now if we talk about the borders of the lungs, we have the anterior border, as I've already discussed. It is thin and shorter. Now anterior border is again well defined. Anterior border of the left lung presents a wide cardiac notch which is occupied by the heart and the pericardium. So here heart is uncovered by lungs, which is known as area of superficial dullness. So when you auscultate with hope, you will hear a dull sound. So this is known as the area of the superficial dullness. Now if we talk about the posterior border, it is ill defined and rounded. It extends from the spine of C7 to the spine of T10. Now inferior border is also known as the diaphragmatic surface, as it rests on the diaphragm. Now if we talk about the surfaces of the lungs, we have the costal surface, which is covered by endothoracic fascia and costal pleura. Now there are impressions for the ribs in embalmed lungs, like in the original lungs in the living person you will not find the impressions, but after embalming, after you get the lungs as a specimen, you will find impression for the ribs. I'll be uploading a dissection video of the lungs too very soon, wherein I'll be explaining about that, so you can appreciate these impressions in that video. Now let us talk about one of the most important topics from this section, that is the mediastinal surface. So the mediastinal surface of the lung is basically the medial surface of the lung, which faces towards the mediastinum. Therefore it has been given the name of mediastinal surface. Now if we talk about that, we have got two parts, okay. One being the small posterior part, which is known as the vertebral part, and the large anterior part, which is known as the mediastinal part. Now the small posterior vertebral part consists of the following structures, being the vertebral column, posterior intercostal vessels, greater and lesser plankton nerves. Whereas if we talk about the large anterior mediastinal part, we have got the hilum of the lung and the impressions. What is hilum? Hilum is basically a short broad pedicle which connects the medial surface of the lung to the mediastinum. It is the place where all the contents enter and exit the lung. So it is very important, and yet it is also an important question which we'll be discussing probably in the next video. Now this is the right lung. This is the medial or the mediastinal surface of the right lung. So it is important that you remember this diagram. These are the structures that form an impression or form a relationship with the medial surface of the lung, right lung to be precise. Okay, first we have got the right atrium. Okay, draining into the right atrium we have the superior vena cava. Then we have the brachiocephalic vein. Then we have the azygos vein draining into the superior vena cava. So you can remember this like that. Also you have the hilum of the right lung here. Then you have the trachea. You have the right vagus nerve, you have the right phrenic nerve, you have the esophagus here. Also you have a small groove here for the right subclavian artery. Okay. Now if we talk about the left lung now, first you have the impression for the left ventricle. Okay, this is where the cardiac notch exists. You have a tongue-like projection here known as the lingula. So this is the root or the hilum of the left lung. You have the arch of aorta forming an impression over the hilum of the lung, and then the descending thoracic aorta. You have the left common carotid artery, you have the left subclavian artery, you have the esophagus here, you have the thoracic duct here, you have the left recurrent laryngeal nerve here, you have the left vagus nerve here, and you have the left phrenic nerve here. So as you can appreciate, the relations of both the left and the right lung are almost similar. Okay, like in left lung you have the left ventricle, impression for the left ventricle, whereas in case of the right lung you have the impression for the right atrium. Here you have the left phrenic nerve, there you had the right phrenic nerve. Here you have the left vagus nerve, there you had the right vagus nerve. You also had the esophagus there, you also had the trachea there. The only difference being you have azygos vein in the right lung making an impression over the hilum of the lung, but here you have the aorta, arch of aorta making an impression over the hilum of the lung. And you also have the left recurrent laryngeal nerve and the thoracic duct here, which were not present there. So we'll continue our discussion on the gross anatomy of the lung in the next video, wherein we'll be talking about the root of lungs, which is a very important question in your university examinations. So thank you everybody, thank you for watching.